So coronavirus is top of mind for not just for a lot of people here in America, but across the world right now. We are joined by Dr. Jon LaPook, CBS medical correspondent, and a couple of questions that we have for you regarding coronavirus, because there is a lot of fear factor that is behind this. What advice do you have for the average person as far as precautions go?
Yeah, well, the best treatment for fear, I think, is facts. And the facts of this are, first, how does it spread? Okay, it spreads by the respiratory route, meaning you cough or you sneeze, you have these droplets come out, and they can infect somebody who's, say, within 6 feet. So the first thing is, if you want to try to protect yourself and others, if you cough or sneeze, cough into the crook of your arm, right? Certainly don't cough into your hand or into the air. We've seen people do that, and people cough into their hand, and then the next thing you know, they're shaking somebody else's hand. The other thing about coughing into your hand is there was a study that showed with medical students, they touch their face 23 times an hour on average. So a lot of us touch our face. You got to wash your hands. And I know nobody wants to wash their hands for 20 seconds that the CDC recommends, saying happy birthday twice. Do that as close as you can, and that's one of the precautions. But I would say the number one thing people can do today, if you have not gotten the flu shot yet, get the flu shot. It'll protect you and your family, because the symptoms of coronavirus can mimic the symptoms of flu and vice versa. So you might have the flu, think you have coronavirus, and really be worried for no reason at all.
You know, you were talking about
Except for having the flu, which can be serious.
Yeah, that can also be serious, and also is still spreading right here in our country as well. You were talking about washing your hands and making sure that you avoid touching your eyes and your face and your nose and whatnot. I mean, some people feel as though we've had a lot of questions from people saying, well, if this is something that can spread and is airborne, will washing your hands really have any effect?
Yeah, so let's talk about what airborne means. That's a very specific epidemiologic word, and I'm going to go deep on this, okay? So pardon me for the med speak, but airborne, like when you think about aerosolized, you're talking about measles, where something hangs in the air and it can be there for a couple of hours after the person has left the room, and somebody can come in and get infected. That's not what we're talking here. It hasn't been shown. I know people are looking for that, but for now, we're not talking about that. We're talking about droplet spread to somebody within 6 feet. Now, it can live on surfaces, and that's being looked at very acutely right now. It could be maybe hours or even days, depending upon if it's plastic or metal or what it is. So we're always touching things. And so if you just follow the rule of keep your hands under your chin, but since we all forget to do that, wash your hands as frequently as you can. And if you don't have the ability to wash your hands and really scrub and make sure you get the fingertips, then those alcohol-based sanitizers we've all seen. There is a trick to using them. People forget the tips of their fingers. Put the stuff in the sort of the small of your palm. Go like that. You turn it over. Get those tips and then go like that. And really get every millimeter of your hands.
Now, you mentioned to us that, of course, the symptoms of the coronavirus can mimic symptoms of the flu. Obviously, there are flu tests that are available. Do we have testing readily available across the country for coronavirus?
It's not readily available, okay? So the main symptoms are fever, cough, and especially shortness of breath, because if you get shortness of breath, it could be affecting your lungs. Now, I spoke to the CDC this morning. You know, there's been a problem getting these kits out. They said that by midweek, we should have the ability to test about 75,000 people. That may sound like a lot, and it's good for areas where there actually seems to be an outbreak, but it's not enough to screen the entire country. And when you think about people coming in to doctor's offices and emergency rooms saying, I've got a little bit of sniffles, I've got a little bit of a cough, and you'd love to be able to just rule it out. You know, there is a test, there's a fast flu test where you do a nasal swab you may have heard of, and it tells you your result right then. There's another one, though, that you send to the lab. It's a PCR, it's called, and it tests a bunch of different things. And you'd love at one of those things on the panel to be COVID-19, to be the coronavirus that we're currently seeing. And then that would be really great. We wouldn't have to be worrying, do I test this person, do I don't? Bottom line is, right now we don't have the kind of capability to do the kind of testing we really need.
All right, Dr. Jon LaPook with the CBS medical correspondent. Thank you so much.